Be ready. 5 seconds. I rise to support the demands for grants for the Ministry of Health and Family Welfare. Sir, the COVID pandemic was an unprecedented event which has not only changed the normal functioning of our daily lives but also exacted a heavy toll in terms of healthcare infrastructure. However, the pandemic has also brought to the forefront the need to have a robust and strong healthcare system in place. Sir, as a medical professional, it is my great pleasure to state that the Union Budget 2021-22 has taken proactive steps in the healthcare domain by focusing on a holistic approach to health and well-being, by targeting to improve the preventive care, curative care and well-being. This is in tune with the recommendations of the Economic Survey 2020-21, which called for improving the health infrastructure. By recognizing health and well-being as one of the 6 target pillars this fiscal year, the Honorable Prime Minister and the Honorable Finance Minister has demonstrated the focus on building a more resilient healthcare system. The National Health Policy 2017 aims at increasing the public health expenditure to 2.5% of the GDP by the year 2025. The Ministry of Health and Family Welfare broadly has 2 departments. One is Department of Health and Family Welfare, which implements the health schemes and regulates medical education and training, and the Department of Health Research, which is broadly responsible for conducting medical research. As we all are aware, last year entire has been a COVID pandemic year, and that is why the government's focus has also been on improving the COVID-19 vaccination in the country, and that is why the government has given rupees 35,000 crore for vaccination program, and the Honorable Finance Minister has also promised that if any additional funds are required, then that will be given. Sir, I was hearing many of my friends from the opposition. They asked what the government has done during the last 1 year during the COVID-19 pandemic. I would like to draw the attention of this august House towards the action taken towards the COVID-19 pandemic management. Health being a state subject also, India is federal political structure, and so while taking any decision, all state governments were also taken into confidence. Various stakeholders and the different community organizations were all brought on one platform to fight against the COVID-19 so as to minimize the impact of the disease. The proper surveillance of people was started at the points of entry. The proper surveillance of people coming from different parts of the world started for airports, seaports and land ports. Also, surveillance within the community was started by Integrated Disease Surveillance Network. Travel advisories were also issued, and continuous update of the travel advisories was also done. Active screening and isolation of the travelers also started. The Government of India has established a national expert group on vaccine administration for COVID-19 to provide guidance on all aspects of COVID-19 vaccination, including prioritization of population, procurement, inventory management, vaccine selection, vaccine delivery tracking mechanism, etc. Two vaccines have been made in India. One is Covishield, which is manufactured by Serum Institute of India, and the second is Covaxin, which is manufactured by Bharat Biotech International Limited. The vaccine, which is prepared by Bharat Biotech, is researched and developed in India under Atmanirbhar Bharat scheme. Sir, many members who were speaking here were asking as to what will happen if the vaccine will get exhausted. I would like to draw the attention of the entire House to the fact that in addition to these two vaccines, 7 other vaccines are in clinical trial and 12 additional vaccines are in preclinical trial stage of development. The group that was formed for prioritizing certain population groups for vaccination was based on extensive review to maximize the COVID-19 vaccination drive impact. Prioritization has been done on humanitarian principle of giving vaccine to those who need it first. So, the first priority group includes all the healthcare workers, second group includes the frontline workers, and third group includes the people who are above the age of 60 or those who are between the age of 45 and 59 who have certain identified comorbidities. Sir, COVID-19 vaccination utilizes the existing infrastructure of the Universal Immunization Program, including the cold chain system. Capacity building of an entire human resource has been conducted in a cascading manner. When vaccination program had to be started, people who are vaccinators or the team of people in the vaccination group also had to be trained. So that training part has also been done. A unique digital platform called CoWIN 2.0 has been developed to facilitate vaccination drive. It helps in registration and tracing of every beneficiary along with real-time information on storage of available stock of vaccine, their storage temperature, etc. After facing the COVID-19 pandemic, the government has taken a very long-sighted decision of increasing the investment in public health and health reforms to prepare India for current and further pandemics. In future, if there is any pandemic, we should be prepared, and keeping that in mind, this budget has majorly focused on two different parts. One part is short term, that is on COVID management, and second is long term to prevent further any such pandemics in the country. The COVID-19 pandemic has brought forth public health challenges and related needs to strengthen health system to make it more resilient and responsive to emergent health situations. Sir, the Union Finance Minister announced the launching of a new centrally sponsored scheme, Pradhan Mantri Atmanirbhar Swasth Bharat Yojana. This scheme aims to strengthen the health infrastructure by seeking to improve primary, secondary, and tertiary healthcare centers along with existing and future national institutions working in this sphere of detection and cure of new and emergent diseases. This will be an addition to the National Health Mission. The main intention under this scheme is giving support to rural and urban welfare and wellness centers and setting up of integrated public health labs in all districts.